All right, guys, so I'm going to start now. Hold on. All right, so for this evening, we're looking at sensory and motor skills development. Hold on for me. Mm-hmm. Suzette, are you hearing me?
Yes, I could prepare.
All right, good. So I'm going to go ahead and
But no
share.
one else is online as yet.
I'm not hearing you.
There's
Ryan,
no one.
Ryan is actually here at the office.
Okay.
Mm-hmm. All right, so we're going to be looking at sensory and motor skill development. Right? This is element one. It says to ensure that the creation of a developmental program reflects knowledge and understanding of the importance of sensory experiences in the overall development process of clients or patients. Provide a stimulating environment to promote sensory and motor development. Ensure that support given by staff in the provision of sensory experience for the individuals does not inhibit the development of their skills and imagination, and encourage and support flexible approaches. Ensure that the program provided for motor skill and development ensures opportunities for individuals to develop confidence and to enjoy the activities, and ensure that developmental programs are provided to balance opportunities for structured activities with spontaneous responses. Ensure that movement and changes are within safe limits. The first thing that they're going to look at is developmental program reflects knowledge and understanding of sensory experience. It says an individual's senses are vital for growth and development. And when an individual's sensory functions are impaired, hold on for me. It says when an individual's sensory functions are impaired, that's his ability to function within the environment of the healthcare facility, you as a healthcare worker, you need to develop an awareness of the sensory experience. And when we're talking about sensory, it's like sight, hearing, smell, touch, taste. So if persons are losing their sense of sight, you have to actually be aware of certain things that you would look out for that person, right? Certain things that you change in the environment so that they don't harm themselves, and also to make them as comfortable as possible, right? It's the same thing for somebody that's not able to hear, touch, smell, taste. That's what we're referring to when we say sensory impairment, right? So it says the sensory experiences are comprised of two components, sensory reception and sensory perception. Sensory reception, this is the process of receiving the stimuli or data, which may be either external or internal. So reception means you receive. So seeing, hearing, smelling, touch, taste, right? Perception now is what you believe the sensory input supposed to be. So like some persons might see something, but it's not the actual thing that they're seeing. That's a problem with perception. Understand? Some persons might be touching things or having an abnormal sensation in the skin or something, but it's not actually there. But that would be an impairment in the way that they feel, right? Same with taste, same with hearing. They're hearing stuff that aren't there, or they're not hearing, okay? Or they hear something, but it sounds totally different from what it's actually supposed to be. So this is what you refer to when you talk about perception. Perception is different, receiving the stimuli, right? And there are some terms here. Kinesthetic means it refers to awareness of the position and movement of the body parts. So, you know, some persons, they have a problem. They don't know that their foot is actually touching the ground, right? Versus some persons, they may actually have problems to know exactly where they are in space, in the space, right? So they tend to fall, right? They don't realize that if they're gonna sit, they're sitting they're going to sit on something that is lower than what they perceive. So like the chair, they think that the chair is a certain height when the chair is actually shorter than what it is. And because of that, you have problems, right? Because they end up falling down on the chair too hard, or it's the case that they feel that the bed is wider than how it is, and they roll off the bed, right? That happens a lot, especially to the elderly. And they have visceral relating to or affecting one or more internal organs, right? So it's inside the body, your organs. And stereognosis is the awareness of an object's size, shape, and texture, right? So those are some of the sensory issues that you may arise. Problems with kinesthetics, problems with visceral pain or visceral problems, problem with stereognosis. Right? People become accustomed to certain sensory stimuli, and when there are drastic changes, the individual may experience discomfort. When clients are admitted to a healthcare facility, they are confronted with stimuli that are different from the ones that are experienced on a regular basis, and so they may become confused or disoriented. So you usually feel a certain way. You know your body, right? But then when things kind of getting abnormal, you become very confused. And if you're confused for too long, because you can't find out exactly what is wrong, you're going to start getting depressed, right? And sad and angry. And sometimes it can cause you to become mental, right? So you have to be aware that when somebody is having something wrong with sensory, right? Sensory issues, it cannot have them being in discomfort for too long. But then on it may make situations worse because they may start becoming confused, depressed, disoriented. Right? So for example, a patient who is placed on bed rest may receive fewer sensory stimuli than usual, and another patient who is undergoing diagnostic tests may receive more sensory stimuli than usual. These and other experiences in a healthcare facility may result in the patient having sensory alterations. Factors which may contribute to sensory alterations include sensory deprivation, sensory overload. Those are two other terms. The sensory deprivation, this results from a decrease in or lack of meaningful stimuli. So decrease or lack of meaningful stimuli. So that's a low. So you're feeling, but you can't. It's like it's not as painful as how it should be. So you get a finger prick, a stick in your finger, and it's like you hardly felt it. Or some persons get a stick in their foot bottom or cut in the foot bottom, like diabetics, and it's like they don't feel it, right? That is sensory deprivation. And then sensory overload is like any little thing now causes you to be in excruciating pain or excruciating discomfort. So some persons, if they just get a little hit, it's like the entire area is in excruciating amount of pain, right? That is sensory overload. And they also have increased external stimuli. So some persons they can't tolerate light, they can't tolerate noise, they can't tolerate certain smell, right? Because once they're exposed to it, it's like it's heightened. Like if you are at 50%, they're like at 100%, right? And there's an inability to disregard or ignore the stimuli. Then you have sensory deficit. Sensory deficit, this refers to impaired reception or perception of one or more senses. When we say sensory deficit, it means that it's totally gone, right? So blindness is sensory deficit. Sensory deprivation would be blurred vision. You still can see, but it's not as good as before, right? Well, sensory deficit is like everything is gone. Say you're deaf or you're blind, right? You should be guided by your knowledge of sensory experiences, including sensory deprivation, overload, and deficit, when creating a program to promote the development of sensory skills. Right? What are the two main components of sensory experiences? We know already. Right? Differentiate between external and internal stimuli. What are the two components of sensory experiences? Right? Reception and perception. Right? Differentiate between external and internal stimuli. External, it has to do with the external environment, right? What is outside of the body. Internal stimuli would be inside the body. Okay? External stimuli. You have internal stimuli. And the different types of external stimuli would be the sight, hearing, smell, touch, taste. And the internal stimuli would be the kinesthetic, visceral, and stereognosis. Those three that we spoke about here. Those are internal stimuli. If you were to get a question asking that, they would know. Why do sensory alterations often occur in a healthcare environment? So, as you know, depression can actually occur. Persons might become deprived of sleep. They might actually be bedridden, and because of that, they lose the senses in their like buttocks or their legs. Those things kind of happen, right, when you're sick. Okay. The other thing that can actually happen as well is that you can get an increase in sensory overload from like you getting multiple injections, right? And you tend to get a good amount more pain from the multiple injections. So those things are what can cause you to have changes in or alterations in sensation. It says outline some of the factors in healthcare settings that may contribute to sensory deprivation and sensory overload. Or we spoke about those just now. All right, working groups of two and define the components of sensory process, including stimuli, receptor, impulse, conduction, perception. We know what perception is, we know about reception, stimulus, we spoke about that, impulse conduction. Impulse conduction would be like nerves, right?
Like a knee-jerk reaction.
Right. Okay.
Or on the box kind of thing.
Mm-hmm. So provide stimulating environment to promote sensory development. That's the next thing, right? So based on your knowledge of sensory experiences, you should now realize that an ideal environment for promoting sensory development vary according to the extent of sensory alterations that the client is experiencing. When working with a client who is experiencing sensory deprivation, your goal should be to maintain a sufficient level of stimulation by increasing sensory stimuli. You should include stimuli in the client's environment, such as a variety of people, ideas, and sensations. Visual stimulation, auditory stimulation. Visual stimulation may be provided by colorful sheets, pajamas, robes, a nursing uniform, pictures, flowers, and so on. So remember, we're trying to promote sensory development with the environment. So ways in which you can help with visual stimulation, colors, right? A lot of colors. So colorful sheets, colorful pajamas, colorful robes, nursing uniform, and flowers, right? Auditory stimulation may be provided by conversation. So you talk to the person more, you read to the person, you give television and radio. Gustatory and olfactory stimulation, that would be taste and smell, may be provided by serving foods of different texture, color, and taste. in an attractive manner. So you don't serve them same foods over again. Right? In addition, favorite foods may also be brought from home if this is approved by the doctor or the nutritionist. And then you have tactile stimulation, may be provided by giving back rubs, turning and repositioning the patient, simple exercises approved by the doctor, and brushing, foaming, and washing hair. For a client who is experiencing sensory overload, your goal should be to provide a consistent, predictable pattern of stimulation to help the client develop a sense of control over the environment. So some of the things that you would do for that would be to minimize the amount of light and noise, offering simple explanations before you do the test, right? So like the blood tests and the examinations that might cause pain, give an explanation as to what you're doing and why you're doing it. Establishing a schedule with the client for routine care such as eating, bathing, repositioning, and exercise. And speaking softly and calmly to the client is another thing. Reducing or eliminating certain stimuli such as the calls and the visitors. And then the environment should provide an optimal level of sensory stimulation in which the client will feel safe and in control. All right, so Mr. Green is an AIDS patient in your facility. He recently complained that everyone seems to be afraid of him and that no one touches him. He's very lonely because he is a very sociable person who is used to having lots of people around. He confessed that he has been seeing things and feels like he's going crazy. What type of sensory alteration is the patient experiencing? Want to think about that one? Seeing things. That's visual, right? And give your reasons. Seeing things. So it's a sensory perception is different, right? Sensory perception is altered because he's seeing things. So it's not sensory reception, right? It's sensory perception. So he's seeing something, but he's thinking that it's something else, right? Working groups to brainstorm realistic ways in which this patient can be provided with more stimulating environment. We spoke about those up there already, right? Make a presentation to the class. So what you would need to do here is like, you would show him things and you would say, hey, this is a cup, this is a plate, this is a computer. What do you see, right? All right, so that he would explain to you what he's seeing. And then for the things that he claims that he's seen, he would try to find the thing that he looks at and say, that is what he's seeing, and say, hey, this is actually a plate, this is actually a cup, this is not what you think that it is, right? So that he would actually get a better understanding. So when he sees it in the future, he doesn't say, hey, that was a dog, it's actually a box, right? Ensure that support given by staff does not inhibit development of skills and imagination. The support by staff does not inhibit development of skills and imagination. So it is important for you to ensure that you give the assistance that you provide and that it doesn't inhibit the skills and imagination of the patient. And some of the goals would be to demonstrate intact functioning of the senses, respond appropriately to sensory stimuli, demonstrate appropriate self-care activities. Those are the three. So demonstrate intact functioning of the senses, respond appropriately to sensory stimuli, and demonstrate appropriate self-care activities. When healthcare staff performs routine care such as bathing and feeding, they should ensure that the routine is flexible enough to provide the individual needs for each patient or client. When assisting the patient with their basic needs, They should administer only the amount of care that the patient requires. So it's not that you're going to give them more than what they need, right? So if you're going there to bathe somebody, don't bathe them, then you're going to do something else with them, like you're going to play a game or you're going to try and read a book for them. If you're bathing them, you just bathe them and then allow them to try and find ways on their own to help themselves, right? So the staff role involves assisting with one, the preparation for the bathroom, providing the necessary articles such as soap, washcloth, and towel, providing a stool chair or assistive device for disabled patients, help to wash and dry hands to reach areas of the body such as the back. Staff should be especially mindful of not over-assisting the patient. So take for instance, a patient is able to use his rag, like rub up his rag, or him able to brush him teeth on his own. Don't brush him teeth for him, because he can brush his teeth on his own. And don't soap up the rag, allow him to soap up the rag, right? If he's having challenges now, then now you will go ahead and assist, right? Persons who are blind or deaf should also be allowed to carry out self-care activities. The role of the healthcare worker is to provide assistance, not to perform the activity for the patient. When assisting the patient with feeding, staff should try to encourage as much self-reliance as possible. They should assist the patient by making the client comfortable, protecting clothing, arranging the food in a particular manner in the tray, providing appropriate eating and drinking aids, cutting foods so that it's easy for them to eat, and pouring liquids, right? It says you should ensure that the staff in your facility provide sensory experiences that allow the patient or client to develop imagination. So this can be achieved by encouraging the patient to read books and newspapers. So instead of you reading it for them, let them try to read it. Do crossword puzzles and encourage it in games that stimulate mental activity. Look at visual stimuli such as photographs and greeting cards. Sit by a window where they can look out, recall foods that taste good in the past also, and pleasant aromas and the events associated with these tastes and smells. Right. We can go through the checkpoint here. So encourage and support flexible approaches, ensure a balance between structured activity and spontaneous responses. So using flexible approaches for sensory development means using unexpected and unplanned opportunities. And we spoke about stimulating sensory experience in the last topic, right? So we don't need to really go into that. But what he's saying here that some everyday activities that provide patients with opportunities for sensory experience would be like if you allow them to dress, bathe, eating, reading a book and newspaper, listening to the radio and television, and social interactions, trying to get them to speak, not to just remain as quiet. It says some everyday activities that you can actually give to assist with motor development would be placing the bedside stand for the client so that it can help with his arms and his shoulder, and then placing a signal cord so that the client must use his arms to reach for it, and encourage the client to sit up and reach for over the table, and encourage the client to try and wash his back when he's bathing, right? It says spontaneous responses and activities. What are those? It says spontaneous means arising from natural impulse or inclination rather than from planning. So it's not that it was a planned thing for them to do that. It's just out of the blue, it was done, right? When you include spontaneous responses in development program, clients eventually will be able to achieve goals and performance independently. So it's not the case that they plan it and therefore they will do it because they already know. It would be something that they develop independently. They thought of it on their own, right? It says ensure that programs provide opportunities for enjoyment and development. So any program that you're doing, it would actually be geared towards enjoyment and developing the confidence of the patient. Okay. It says exercise activities have numerous health benefits for different systems of the body. And some of the things that you would look at would be the cardiovascular system, respiratory system, right? Musculoskeletal system, gastrointestinal system, metabolic system. And that is all because um, what happens with these activities is that you're aiming to assist with improving the patient without medication, right? Just like motor development is like you're trying to develop strength, the posture of the person, the balance, and the perception. Is the same way when you do that, you're trying to improve these the heart, the lungs, the muscles, the intestine, and the blood, right? And says, in addition to health benefits, exercise activities also have psychological benefits. So, an invigorating feeling and increase in vitality, and that's because of hormones. And it said, decreasing stress level, improves their self-esteem, improve your self-confidence and your body image, and enhance your mood and your mental awareness, right? And there's the importance of exercise, because what happens is that with exercise you get an increase in motor development, and that not only assists with physical, but it also assists with mental health as well. Okay, and it increases your self-confidence and improves their self-concept. Then now looking at ensure that movement and changes are within safety limits. All right. Ensure that movement and changes are within safe limits. I wonder if everybody hold on. Suzette, you're okay?
Yes, Dr. Tracy.
Okay, I know it's a lot. And I'm seeing Colette online. Ryan is in the background here. So I hope it's not too much, but it's pretty straightforward though. It's just that it's looking at how you can increase the sensory aspect of the patient and increase the motor aspect of the patient so that it actually improves their overall health by improving their heart, improving their lungs, improving their vital organs, right? So now it says ensure that movement and changes are within safe limits. They say a major role of the healthcare provider, including healthcare assistants, is to maintain a safe work environment. You should always be cautious and alert in order to prevent any accidents from occurring. And one such procedure involves carrying out physical activity and exercise with the client. So some of the things that you would do in your physical activity is doing a range of motion exercise. You gradually start slow and then increase intensity, right? And it should be smooth and rhythmic. Irregular and jerky movements are not recommended. It says avoid overexertion. So you know some people do a lot of exercise for hours. Don't do that. Just minimize it to maybe like 30 minutes. It says avoid attempts to achieve full range of motion. Remember, some of them have problems with their shoulder and their hip, so you can't be trying to force their arm way around in 360 degrees, right? Because they might have problems with their shoulder, why they can't do that. So move each joint until there is resistance but no pain. Once there's pain, then you stop, right? And when exercising the joints, use a variety of support measures to prevent muscle tear, such as cupping, cradling, and supporting the joint. It said keep friction to a minimum when moving extremities. And note respiratory and heart rate. If they're increased drastically, then you probably need to stop Okay, just ensure that it's always within the normal range, the heart rate and the respiratory rate, and not overly exerted. And for clients who have been on long periods of bed rest, plan short distances for walks as the patient may feel faint or dizzy. So because they're in the bed for so long, their balance is changed. So you can't have them walking for too long or standing up for too long because they might faint. Okay? And it says here, each healthcare facility in which you work should have an occupational health and safety policy which outlines relevant enterprise policies and procedures. And as you should ensure that you follow all the regulations and of the policies and procedures. So if you start working at a healthcare facility, make sure you read through the policies and procedures before you actually go ahead and start working so you can know exactly what you're going into. It's an element to create developmental program for sensory and motor skills. All right. To create development programs for sensory and motor skills. So what the first thing that we would want to do is to design and implement appropriate programs for stimulating physical development. And before you even go into planning, you would need to know what we talk about motor skills. So motor skill is a skill that requires individuals to utilize their muscles, skeletal muscles. Motor skills and motor control depend upon the proper functioning of the brain, skeleton, joint, and nervous system. And most motor skills are learned in early childhood, although illness and disabilities can affect motor skill development. So by now, you should be aware of the important roles of healthcare workers in providing an appropriate motor development. If you don't allow your patients to move, then they can end up with blood clots in their legs, and they can also get pressure ulcers, and they can get contractures, meaning that their joints can get stiff to the point where they can't move, right? It says motor skills are divided into two parts. You have gross motor skills and you have fine motor skills. Gross motor includes lifting one's head, rolling over, sitting up, balancing, crawling, walking. Motor development, it uses the big muscles. So you like lifting up your arm up in the air, or you like bending and touching your toes and stretching and doing jumping jacks and push-ups and those things. Those are gross motor skills and walking, right? But thus, gross motor development is the foundation for developing skills because it's the gross motor skills that are going to really help with health, right? It's not really the fine motor that much. It's the gross motor, right? To move your legs, to move your arms, to sit up, to stand up, to touch your toes, to walk, right? Those are the main things that really help with developing the motor development of the patient. Then you have fine motor skills. These include the ability to manipulate small objects, transfer objects from one hand to the next, and various hand-eye coordination. Fine motor development refers to the development of skills involving small muscles. So small muscles would be in your finger, right? So for you to hold a pen, or for you to hold a fork, or for you to wiggle your fingers or wiggle your toes, right? Wiggle your toes, or move your fingers, or for you to move your eyes from side to side, or look up and down, or to right. Those are what we consider fine motor, using small muscles, right, to do. It says an understanding of gross and fine motor will help you to design an effective physical development program. They're aware that even though the fine motor might not be so big in making sure you're healthy, right? If they go bad, they can cause a lot of problems, right? So like if you have problems to close your eyes can get dry and you can get infection in your eye, right? If you're not able to wiggle your fingers or to move your fingers, they can become stiff and then you can't bend your fingers and then you cannot use your hand, right? And like if your toes, you can't move your toes, you can't bend your toes, then you're at risk of fractures to the toes and you can fall because toes aren't flexible enough to balance. So even though they're small muscles, they're very important, right? It says a balanced physical development program includes aerobic exercise, stretching exercise, range of motion exercise, strengthening exercise, endurance exercise. And when you're designing an exercise program, it should be one or a selection of or combination of them. So when we look at range of motion exercise, it is the normal scope of movements of the client. So you know your joints do a certain movement, right? So your knees would bend and straighten. Your shoulder can go round or can go up and down and forward or backwards. Your hip can go to the side, it can go forward, it can go backwards, or it can go across the leg. Those are what we call range of motion. You just basically try to pinpoint what the different joints can do, right? And you just try to do the exercise for those. So when your clients are unable to do these exercises, you should try to do the exercise, try to help them do the exercise. So the different types would be active, active assisted, passive. Active range of motion exercise is when the client can do the exercise on their own. Active assisted is when the healthcare worker is required to assist the patient to do part of it on their own. And then passive is when the client is unable to move any at all, and therefore you as a healthcare assistant have to do it for them, right? And you should notice that both active and passive exercises improve the joints, whether it be you doing it or they doing it or are you assisting them to do it, it helps. And active exercises also improves your cardiac and respiratory function, okay? And then there are some certain guidelines for assisting clients with range of motion. One is explain to the client exactly what the exercise is about and show them how it's done so that it can help them to do it properly and not note safety measures that would be needed. Return the joint to its neutral position. So if the person's arm was to the side, don't leave the person's arm up in the air, right? Or behind the back of their head. Use range of motion exercise twice a day and expect the client's respiratory and heart rate to increase during exercise. Therefore, you should monitor the heart rate and use passive exercise if it's only necessary. If the person can move the neck, don't go there and move up the person's neck. Let the person move the neck on their own. And the role of range of motion exercise is for the best possible physical state while bed rest is necessary. Prolonged periods of bed rest are no longer considered necessary during most illness, and some form of activity is usually needed, right? And some of the exercises that you would actually do for to increase the range of motion would be like the quadriceps drill, and look at push-ups and dangling, right? You can read up on these quadriceps drill, push-ups and dangling. And then assisting clients to walk. That's the next thing we're gonna look at. Hold on for me, please. All right. So, assisting the person to walk, right? Very, very, you have to be very careful when you're doing this. So, Many clients who have been placed on bed rest for prolonged periods find it difficult to walk, right? And it is your responsibility to assist them to walk, unless they don't have any legs or they have severe problems with walking, then you shouldn't do that, right? So assess the patient's ability to walk. So see they said, check the person's ability to walk before you give them any assistance, right? You may need one nurse, two nurse, walker, or cane or crutches. Explain the clients exactly what is to be done. This includes how the patient will be transferred from the bed, approximate walking distance, and assistance available. Ensure that the client has a clear path for walking. As a healthcare assistant, you may be required to design the physical development program in collaboration with a physical therapist. So you talk to the physiotherapist so that they give you some guidance as to what the person should do. And you incorporate both the planned exercises with what they do daily, right? To make sure that you're not hindering from their daily activities. And it says here, institute and maintain direction and supervision for caregiver. It says, as a supervisor or manager in a healthcare facility, and hopefully majority of you guys will become a supervisor or manager, right? You will be required to supervise caregivers as they work with clients to implement programs for both sensory and motor development skills. Supervision is a means of directing, supporting, and keeping abreast of the work done by those staff members that you are responsible for. Your supervisory duties may include training new workers, assigning duties to staff, making sure work is being done safely and efficiently, provide support, and assisting with work tasks. You should provide supervision for staff from the time they start to work in your facility. This supervision should be clearly defined, especially when there are new employees, so that they understand what they need to do and they don't make any mistake. And sometimes you have to give them a written explanation, like a job description, right? And remember that a lack of training can cause a lot of misunderstanding and poor staff performance, and also inadequate patient care. And it's important to supervise staff on the ongoing basis, because a well-supervised staff does a better work and they also adhere better to the policies and procedures. And it reduces the probability of staff not performing to the standards. And adequate supervision can help to recognize and change potential problems before they become a problem, actual problem. And supervision and constructive feedback can result in better employees and more effective organization. Constant observation of your staff will allow you to evaluate their performance, and the best care for clients is your major responsibilities, right? So you should encourage flexible approaches which are balanced between structured activity and spontaneous responses. And you need to just kind of look back on that to make sure that everything that you do is going to go according to plan. So if for some reason they do something out of the blue, at least they have the knowledge to know that, hey, it is still whatever they're going to do is supposed to go according to a certain procedure. Because it's not every day everybody is going to do the same thing the same way. For some weird reason, they might deviate a little from the usual, and it's just human nature for you to deviate, right? But at least if they got the adequate training and knowledge, even if they deviated from a certain procedure, then it would be according to what they know to be right. Okay? It says, ensure that communication techniques are consistent with clients' level of development. Communication technique consistent with patient's level of development, right? It says communication is a two-way process for sending and receiving messages to create a common understanding between two persons, right? So one, you send a message. Two is to receive the message and to understand the message. and to send the message in a way that people can understand, right? It said here are some guidelines for communicating with persons who are visually impaired, right? So visually impaired, hearing impaired. Visual, acknowledge your presence to the person when you come in the room and identify yourself and speak in a normal tone. Some persons tend to speak louder because they think that the person can't hear, but the person can hear. It's just that they can't see. But you're screaming, thinking that they can't hear when they can't, it's only see, they just can't see, they hear. It's perfectly fine. And always explain what you are about to do before touching the person. Explain the sounds in the environment and stay in the client's field of vision. So whether if they're partially impaired, at least they feel some form of sense of belonging when you stay in their field of vision rather than stepping out of their sight. And indicate when the conversation has ended and when you're about to leave the room. For persons who are hearing impaired, before starting a conversation, you need to convey your presence by moving to a position where you can be seen, decrease background noise, talk at a moderate rate and in normal tone of voice, and address the person directly, talk to them directly, and make sure that they can see you, right? And avoid covering your mouth with your hands when talking, and always speak as clearly and accurately to the person. If the patient is confused, for example, if the patient has dementia, you should establish and maintain eye contact. I already did videos to show how to handle somebody that has dementia, right? And you should keep communication simple by breaking down the instruction because they have dementia, so you have to give them like, one-step commands. You can't give them complicated stuff to do. Another type, special type of client with whom you may be required to communicate is the unconscious client. You should know that hearing is the last sense of the person to go, and therefore, even though somebody is unconscious, they may still be able to hear you, right? You should assume that the client can hear you, therefore you shouldn't talk anything that is out of the norm about them, right? And you should talk in a normal tone, just like you're talking to a normal person. And keep the environment noise low, and to be sure to speak to the client before touching them, right? Don't just touch them like that, even though they are unconscious. All right. As a healthcare assistant, it is important that you maintain effective communication with all of your clients despite their level of development. Be sure to pay attention to the client's age and stage of development, abilities, impairment, health conditions, and cultural background when communicating with them. All right. All right. And these are some questions that you could go through. Basically, these checkpoints are basically a summary of what you spoke about. All right. It's a work in simulated environment to role play the scenario which depicts the incorrect and correct communication techniques when working with the following: visually impaired, hearing impaired, confused patient who is delirious with dementia. We did number 3 already, right? Remember we went through that. So we'll go through a video with visually impaired and hearing impaired. And this activity should be carried out in groups of 3, and your colleagues and learning facilitator will critique their performance. All right, it says here now, the next section. Ensure that nutritional programs are appropriate. Nutrition refers to the process in which the body for utilizing food, including processing the body for utilizing food, including eating, digestion, absorption, and utilization of nutrients, and elimination of waste. And nutrition is an important part of the total care of the patient. Therefore, it is important that you have knowledge of proper nutrition so that you can promote good health. Okay? It says all individuals have certain nutritional requirements, and you know already that it depends on the person's health condition, right? And you find, for example, that the nutritional requirements for an infant will be different from an adolescent, and different from an adult, and different from an elderly patient. and an individual's degree of health or disease may also be impacted by the nutritional needs and food modifications required based on their health. So if the person has diabetes, then you have to modify the type of food. If the person has high blood pressure, you have to modify the type of food. And you already know that sensory deprivation occurs when persons experience a lack of meaningful stimuli. They can use their sense of smell and taste to experience some sense of stimuli. So you can play around with the person's sense of taste and smell so that they eat more or eat the type of food that you want them to eat. So providing, so as such, you can stimulate someone's taste and smell by doing the following: providing food for different textures and color, serving foods in an attractive manner, seasoning foods for maximum taste, and also allowing them to bring favorite foods from home if clearance is given by the doctor or the nutritionist. Right? It says, you should note that clients with sensory deprivation also require some visual and auditory stimulation during mealtime in order to face to face. So you have to let the food look pleasing and, you know, in a pleasing manner. Some of your patients may have illnesses, injuries, impairments, and medical conditions that restrict their ability to eat certain foods. As you know, they might not be able to get up, hold a fork, or they have problems with their fingers, have arthritis in their fingers, so they can't lift up the fork. So therefore, it says, ensure that the food is served at an appropriate temperature, especially for clients with decreased tactile sensation, right? Because they might burn up themselves. Provide appropriate assistance for clients with limited mobility, assist individuals in the use of eating and drinking aids, ensure that these eating and drinking aids are appropriate to individuals' level of development and medical and physical conditions, encourage clients to participate in the feeding process as much as possible, as this will improve their self-care. And then there was another activity, so you can go through that as well. So we're now at establish safe and secure environment and establish and maintain health and safety procedures. It says, by now, you should be aware that one major role of a healthcare provider, including healthcare assistants, is to maintain safe and secure work environments. Environmental safety refers to the condition of an entire facility, patient room, hallways, and all departments. And the environment should include the environment includes the sleeping area, the play and recreational area, the temperature, the light, the walls and floors, the plumbing, the electricity, the equipment, and furniture. When you care for clients with sensory deficits in your healthcare facility, you are required to implement certain safety precautions, and these include noise. So you address issues with noise, access, lack of clutter or obstructions, use of stairs, assistive devices for sensory impairment, right? That's the presence of assistive devices. Those should be in there. It says, here are some guidelines for creating safer environment for clients with visual and hearing impairment. Orient the client to the arrangement of the room, meaning that, you know, if you're going to put somebody in a room, you say, hey, this is where the food should be kept. This is where the bed is always, we'll put the bed here because it's closer to the window. Or you said the bathroom is here, and if you need towels or if you need a tissue, you know, you call to us and we'll carry it to you. And when you finish with your bedpan, you just leave it under the bed. All of those things kind of help so that they don't get confused and have to keep calling you every minute to find out what to do, right? It says, keep pathways clear and do not rearrange furniture without informing the client. Ensure that spills are cleaned up immediately to avoid falls. It says, organize self-care articles within the client's reach and inform the client of their location, and help clients to obtain devices that amplify sound, reduce environmental noise such as intercom, loud conversations, and so on, and use sound absorbing materials whenever possible. Clients with an impaired sense of touch may not be aware of hot temperatures, which can cause burn, right? So you should ensure that temperature of the water heater is adjusted for clients with decreased sensation and temperature. You have a responsibility to make careful observation so that you can identify when anything in the environment is not working. These safety hazards should be reported to the appropriate person, such as the housekeeping and maintain departments, who will then repair them as soon as possible. Some of your clients may have setbacks in their motor development because of the illness that they have had or injury. And it's your responsibility to ensure that all the furnitures and equipment that they use are in the proper place and that they're functioning properly at all times. And there is a working call light bell in case they need to be reaching you. Bedside tables and overbed tables are also there to ensure that it assists the persons so that they do not have to overreach for stuff. And beds and positioning should be positioned properly and have adequate height, right? And side rails and restraints are used safely and appropriately, only when needed. Not all the time you're going to restrain someone. And bed wheels are locked because the bed might roll away with the patient, and God forbid it roll through the door and roll down the staircase and roll straight into the road. You can imagine that, eh? That would be a surprise. Anyway, all right, so establish health and safety procedures. Most healthcare facilities establish rules and procedures that are designed to keep both staff and clients safe. And therefore, it is important that you follow the procedures that are in place when caring for the patient, right? This is especially important for patients with sensor alterations or mobility challenges. When you are unsure about the correct actions to be taken in a particular situation, you should consult the appropriate written guidelines before proceeding. It is important that you ensure that all procedures and practices that are implemented by your healthcare facility or by yourself comply with government health regulations. All right? And that's basically it. So we're finished with sensory and motor